Hello everyone, I am Dr. Sadeep. Welcome all to our Demo Medico to Divine Master session. Today I am going to talk about hot patient and chilly patient, friends. So this will be a big confusion in our practice and in our academics also. So both we will address today and make you understand how this problem can be sorted out. First of all, friends, so as you understand, if the patient is chilly, so he will be very sensitive to any cold atmosphere, AC, or outside the any of the rooms. So whenever he goes outside the room to the environmental weather, so he will be aggravated. So this is called as chilly patient, as you all know. So another is hot patient. So hot patient is aggravated by hot. So wherever the patient is aggravated by sun hot or any of the radiation hot or in a closed room or by blanketing himself, this is all called as a hot patient, as you know. So in the practical purpose, so we will be in a it will be difficult to ask the patient directly he is sensitive to which type of weather. So you can put a simple question, which weather he likes. So which weather if he likes, whichever weather he is liking will be his core finding. That is, if he is very sensitive to cold, he will not like cold. So he will be in a opposite desiring. Like if he is a chilly patient, he will be always wearing suits and he will be always wanting warm atmosphere near him and he will be in a closed room. So this is the thing he will be desiring. So if the patient is hot, so he will be wearing very less clothes. He will be very interested in his AC, fan and everything. So this is as you know normally. So when a case taking you are taking, so it will be very difficult so to convince the patient to make us understand in which weather his complaints will be aggravated or in which weather the patient is comfortable. So one thing what I will be doing or what is in my practice is, friends, whenever there is a AC or fan in my room, so that itself will trigger a patient to present his symptoms. So if he is chilly patient, he will start asking the doctor, so please reduce this temperature of this one AC or the fans. So they will be asking like that. Then you can consider it as a chilly patient. So if the patient is hot, he will be not asking for that. So he will be asking in a reverse direction. That is, he wants the AC to be more cooler or he wants the fan to be more higher range of circulation. So this is about the practical purpose of our hot and cold, friends. Many a times the patient is not at all comfortable in telling hot or cold. He will be telling that he will be aggravated by hot also, he will be aggravated by cold also. This will put a big question in which category we must put the patient into. So in these conditions, I will totally bypass this hot and cold thing, because what is that is, if we struck in one aspect, the remaining aspects we will miss. Due to that reason, what I will do is I bypass this hot and cold patient theory only, so that we can understand the patient more deeply and more mind symptoms we can focus on, and we can bypass this hot and cold aspect and we can understand the core of the patient, that is mental state, general physicals, or whatever he is more comfortable with, in which condition, in which atmosphere, that is, I mean to say in mental atmosphere. I mean to say, like if he is playing music, he will be comfortable. If he is reading, he is comfortable. And being in a travel, he is comfortable. So whatever is he comfortable, that we must note of. So by that, what we can do is, we can bypass this hot and cold thing and we can directly go to the mind aspect of the patient. So this I will be doing in my practice, friends. You can also apply this in your practice. So another important thing to bypass this hot and cold aspect is desire aversion, if you come to know properly. So if he is the patient is desired to very much desired with very specific thing, you can take note of those things. That will also help in totality of the symptoms. So another thing which I will be focusing is the irritability fears. So if you can focus on the irritability of the patient, anger and disappointments and fear of the patient, that will be also helping us to get the totality of the symptoms. To bypass hot and cold, we must go in a broader aspect to understand the patient. So in this way, I will be bypassing many a times. So I will not consider much of the hot and cold aspect, because patient will be confused and he will be confusing us also. So better you just leave that aspect and trigger the other symptoms which he is more suffering with. So that is one of the things. And in academics, friends, it will be very difficult to tell the same thing to our professors or to the examiners. So it is academic section, if you come to, then you must by heart it. So there is no other go around, because whenever we were in the colleges, so it is always a question, what is this here, Bryonia is cold or hot or cold or hot. So it will be a confusion thing. So nothing like that. Bryonia is hot only. So fix a thing in your mind that Bryonia, Apis mellifica are hot only. So there are few conditions wherein Bryonia may be cold. There are some conditions when Apis mellifica is cold. But for examination point of view, these people are always hot. This is clearly given in our Materia Medica and in our repertory. Everything is very sure and short, like it is black and white. So in that condition, nothing to worry about this hot or cold or confusion, nothing confusion. These things, whichever is hot will be in a hot category, whichever is in cold, which will be in a cold category. You can make a note of all the cold category medicines, you can make a note of all hot category medicines. And there is in between category also, that is both sensitive to hot and cold. You can put it in a middle category. So this we were doing in our college days, friends. So you can also do it very properly and systematically. So this is about hot, cold and in between temperature. So another thing what you must note is psora, syphilis, psychosis. So these are the as you know, miasms. So many a times psora will be hot or cold. So it will not be in between. So tubercular are the miasm people who are in between. So they will be not hot, they will be not cold. They will be triggered by hot, they will be triggered by cold also. So miasmatic study also helps you to understand the patient. So I will take a complete session on each miasm, friends. So this is about hot and cold. I want to make you clear about this hot and cold and what is the solution to bypass this hot and cold. So today this is about a session about hot and cold patients. So if you like this video, please share this video, subscribe to our channel. I will be getting this homeopathic in practice and in academics, how to deal with these things. So if you like this video, so this is the session today I wanted to talk about. So I think you understand whatever I wanted to make you understand, friends. Thank you and take care. We will meet you in the next video. Thank you. Take care.